May I come in, doctor? Yes, come in. Take your seat. Thank you, doctor. What's your name? Sir. And how old are you? I'm 29. Okay. Now tell me, what are the problems that you are facing? Since yesterday night, I have been having severe stomach ache. I took an antacid last night, but the pain was still the same. Any other symptoms? Yeah. I also had bouts of vomiting last night, and today morning as well. Do you have a headache? No. Did you have this kind of stomach ache before? Yes, doctor. I had it once before. How many days ago? Almost 3 months ago. But at that time the pain stopped after I took an antacid. Please lie on that bed. I have to check. Okay, doctor. Does it hurt here? Yes, doctor. It hurts a lot. Okay. You can get up now. Is it something serious, doctor? I can't say now. I'm writing down some tests. Try to do this by today. But what about now? I can't even walk properly because of the pain. I understand. I'm giving you an injection for temporary relief. Injection. Don't you have any medicine? Why? Are you scared of injections? It's not like that. I mean, it would be better if you could give some medicine. Nothing will happen, you won't even feel it. Look at that side. Please, doctor, be careful. You can open your eyes now, it's already done. Oh, it's done. Thank you so much. I did not feel anything at all. After receiving the test reports, bring them to me as soon as possible. There is nothing to fear, right? Don't be so scared beforehand. Let's see the reports first. Would not you give me any medicines, doctor? I'm prescribing this medicine. It's just for today. Take it after your dinner. Okay, doctor. Where shall I submit the fees? Please submit that in the cash counter. Thank you, doctor. Welcome. May I come in, doctor? Oh yes, come in please. Oh. Okay, doctor. Oh yeah. Let me check them. It's not that serious, nothing to worry about. It was just food poisoning. I'm writing down a medicine. Please take them for 1 week after dinner. Sure, doctor. Thank you. And you face this problem again, come back immediately. Here are the reports of the tests that you give. You are welcome.
Viewers, Dr. Abubakar Sawar is with us today, who is an angiogram specialist. Thank you, Doctor, for taking some time out of your busy schedule to answer questions about angiograms.
It's my pleasure.
Viewers, you will stay with us to know information about angiogram. Let's ask the doctor, what is angiogram?
An angiogram is an X-ray test that uses a special dye and camera, fluoroscopy, to take pictures of the blood flow in an artery, such as the aorta, or a vein, such as the vena cava. An angiogram can be used to look at the arteries or veins in the head, arms, legs, chest, back, or belly. Common angiograms can look at the arteries near the heart, coronary angiogram, lungs, pulmonary angiogram, brain, cerebral angiogram, head and neck, carotid angiogram, legs or arms, peripheral, and the aorta, aortogram.
What is it done?
An angiogram is done to detect problems with blood vessels that affect blood flow. Examples of such problems include a tear in a blood vessel, which can cause blockage or internal bleeding, aneurysms, which are weaknesses in the blood vessel wall, and narrowed areas. Look for changes in the blood vessels of injured or damaged organs. Show the pattern of blood flow to a tumor. This can not only help show how much the tumor has spread, but also guide treatment. Show the condition, number, and location of renal arteries before a kidney transplant. Look for a source of bleeding, such as an ulcer. Prepare for surgery on diseased blood vessels of the legs, peripheral arterial disease, in people who have severe leg pain when walking. Check how bad atherosclerosis is in the coronary arteries.
What are some preparations needed for it?
Do not eat or drink for 4 to 8 hours before the angiogram. The test may take several hours, so you will empty your bladder just before it begins. Before an angiogram, tell your doctor if you are or might be pregnant. Are breastfeeding. Use formula, throw out your breast milk, for 1 to 2 days after the angiogram until the dye has passed from your body. This generally takes 24 hours. Are allergic to iodine dye used in the test? Are allergic to any medicines? Have any bleeding problems or are taking blood-thinning medicines? Have a history of kidney problems or diabetes, especially if you take metformin, such as glucophage, to control your diabetes. The dye used during an angiogram can cause kidney damage in people who have poor kidney function.
How is it done?
During an angiogram, a thin tube called a catheter is placed into a blood vessel in the groin, femoral artery or vein, or just above the elbow, brachial artery or vein. The catheter is guided to the area to be studied. Then an iodine dye, contrast material, is injected into the vessel to make the area show clearly on the X-ray pictures. This method is known as conventional or catheter angiogram. The angiogram pictures can be made into regular X-ray films or stored as digital pictures in a computer.
What happens during the procedure?
An angiogram is done by a radiologist. The radiologist may be helped by another doctor, a radiology technologist, or a nurse. You will need to take off any jewelry. You may need to take off all or most of your clothes. You will be given a gown to wear during the test. You will likely have an intravenous IV line in a vein in your arm so your doctor can give you medicine or fluids if needed. A device called a pulse oximeter, which measures oxygen levels in your blood, may be clipped to your finger or ear. Small discs, electrodes, are placed on your arms, chest, or legs to record your heart rate and rhythm.
How does it feel during the procedure?
You may feel a brief sting or pinch from the numbing medicine. Most people do not have pain when the catheter is in the blood vessel. You may feel pressure in the blood vessel as the catheter is moved. Let your doctor know if you are having pain. You will probably feel some warmth when the dye is put in. This feeling lasts only a few seconds. For some people, the feeling of heat is strong, and for others, it is very mild. You may have a headache, flushing of the face, or a salty or metallic taste in your mouth after the dye is used. These feelings do not last long. Some people may feel sick to their stomachs or may vomit, but this is not common. After the test, you may have some tenderness and bruising at the site where the catheter was inserted. You can drink extra fluids to pass the dye from your body unless your doctor has told you not to.
Are there risks for this procedure?
Yes, the chance of any major problem from an angiogram is very small, but some problems can occur. In most cases, the problems occur within 2 hours after the test when you are in the recovery room. If the problem occurs during the angiogram, the test may not be completed. You may need urgent treatment that could include surgery. Examples are, there is a chance of an allergic reaction to the iodine dye. The reaction can be mild, itching, rash, or severe, trouble breathing or sudden shock. There is a small chance that the catheter may damage a blood vessel or dislodge a piece of clotted blood or fat from the vessel wall. Bleeding from the needle site may occur. Also, a blood clot can form where the catheter was inserted. The iodine dye used for the test can cause water loss or direct damage to the kidneys. This is a special concern for people who have kidney problems, diabetes, or who are dehydrated. There is always a small chance of damage to cells or tissue from being exposed to any radiation, even the low level used for this test.